Thanks for joining me for this brief overview of the MyShare medical benefits package. Firstly, I'm going to start with page 3 of the brochure, which you can access by the link somewhere near this video on this page. The MyShare benefits plan consists of 3 distinct parts, and I'll describe them here. Additionally, there's 3 options: a 5,000 option, a 2,500 option, and a 1,000 option. And remember, there's no lifetime max for any of these options, and I'll discuss what these options mean in just a minute. Firstly, the membership benefits portion of the plan, which is brought to you by BWA, stands for Business Workers of America, and it includes all kinds of excellent member benefits, more than just what you see on this page. However, primary care doctor's visits, $25 prepay, and a $50 prepay for specialists. All right. Secondly, the insured portion of the plan is made available through APL, American Public Life, and it's indemnity insurance. More on that in a minute. And then thirdly, the third portion of the plan is shareable benefits made available through Zion Health, an outstanding catastrophic health share benefit built into this plan. And I'll discuss that as well. So yes, you do have this excellent option for primary care doctor's visits and specialists, $25 and a $50 prepay. Also, the telemedicine in this plan, unlimited phone and video doctor's visits at no cost. That's 24/7, 365. Virtual video doctor's visits or phone call visits at no charge. And by the way, 7 out of 10 telemedicine appointments are handled without the need for a second appointment. 7 out of 10 times somebody calls in, they do not need a follow-up appointment. Now, the person on the other line of the phone can call in a prescription if one is needed, which is an outstanding element as well. Imagine you wake up in the middle of the night, you have a stabbing pain in your stomach. You don't want to go to the ER because that can be very expensive. So you call into telemedicine. They say, yeah, you know what? Don't worry about it. We'll call you in a prescription. Go pick it up in the morning. Not to worry. Go back to bed. Okay. Peace of mind there, and incredible cost savings on the 24/7, 365 telemedicine at no cost. Additionally, part of the membership portion of the plan is the advocacy services made available by MBR, stands for Medical Bill Repricer. And actually, that's exactly what they do. They reprice medical bills and lower them for you. They also have a professional bill negotiation element built in, as well as healthcare concierge navigation. What that means is you have a phone a friend in your pocket. You can call up to these folks. They can help you understand your benefits. They can help you navigate, finding providers and seeing what's going to be best for you, cost saving wise, etc. And of course, repricing your bills to lower them for you. An outstanding benefit of the plan. Also, prescriptions. Your pharmacy card saves you up to 80% on certain prescriptions at local pharmacies, which is an outstanding savings on your prescriptions as well. On the shareable portion of the plan, this is really the catastrophic element of the plan. This is the part where if you have an incident, you break a leg or you go to the ER or you get pneumonia and you're hospitalized, this is where the catastrophic element of the plan kicks in. It is a share plan, which is different from insurance. However, this is why the cost savings on this plan are incredible. I spoke with a friend recently who switched to this plan. His plan through a certain major medical insurance provider, he was paying $1,900 a month for his family plan. That's almost $2,000 a month for his health insurance, and which is incredible. And he's saving over $1,000 a month after he switched to MyShare. Imagine what you could do with an extra $1,000 a month back in your budget, back in your pocket. Maybe you can afford more groceries. Maybe you can go on that vacation you've been putting off. Maybe you can get your spouse a really nice dinner, a really nice treat, right? Incredible savings for a plan like this. And one of the reasons is it's a share plan, okay? So an IUA, right here, initial unshareable amount, works similar to a deductible. An initial unshareable amount is the amount you, the member, are responsible for paying before the plan begins sharing costs. Now, once you meet your IUA, the plan shares costs 100%. shareable at 100% after IUA is met. You'll see this language here. Now, for example, you break your leg, you go to the ER, and all of a sudden you have to be admitted to the hospital because they need to do surgery and it's bad. Okay. Well, you're going to meet your IUA in that instance, $1,000 IUA. Let's say you're on the $1,000 plan option. Well, you have a $1,000 IUA for that incident. So what that means is you might end up all total with $30,000 or $40,000 worth of medical bills between the ER and then the admission to the hospital, et cetera, and the surgeries and all the stuff. However, listen, your responsibility is only $1,000. So incredible, right? Because everything is shareable 100% for hospital and surgery, anesthesiologists, all these things, ER, labs, etc. After you've met your IUA. So now, even better than that, the indemnity hospital insurance portion of the plan is going to reimburse you for some of that thousand. And I'll touch on that in a second, but it's incredible. Okay. So now you've met an IUA for that instance, and let's say, God forbid, you get pneumonia and you have to go back to the hospital. Well, you have an IUA for that as well. So $1,000, okay. And then let's say you need Tommy John surgery because your left elbow is, breaking down because you play baseball or tennis, right? Tennis elbow. Oh, that's your third IUA. Okay. In a rolling 12-month period of time, you've now met 3 IUAs, and therefore, if you have another incident, everything is shareable 100% from the beginning of the new incident. God forbid you have 4 separate incidents in a year's time. But check this out. You're only out of pocket $3,000. Everything after that is shareable 100% by the plan. Okay. So you only came out of pocket 3,000, and the next incident from the first dollar on medical needs, it's shareable 100%. So the rolling 12-month period, the way it works is rolling. So a traditional deductible plan is based off of a plan year. Okay. So if you meet your deductible, you don't do anything all year long on a deductible plan. Let's say you have a $10,000 deductible. A lot of people do. You meet your deductible in December. Well, now all of a sudden your deductible resets January 1st. And now you got to meet it again, right? And that sucks. Now, this plan is a rolling 12-month period. So if you meet your IUAs in December, it's not going to turn over and reset in January. It's going to be met for the next 12 months. All right? So way cooler, way better than a traditional deductible health plan in that instance. Additionally, with the IUA, you break your leg, okay, you go to the hospital, you've got a $1,000 IUA for that. Everything after the $1,000 IUA is shareable 100%. Now, you don't have to meet another IUA for that instance, even beyond the 12-month period if you still have symptoms and issues for that leg. You don't have to meet another IUA for that injury to that leg and the expenses related to that leg until you're symptom-free for 12 months. How powerful is that? Okay. So that's a little bit about IUAs. And again, you're getting white glove advocacy, cost saving assistance up until the IUA is met. Okay. There is also an end of life sharing benefit as well. In the event of an untimely death, there's a little bit of benefit for you there. Moving on, this is a little bit about how it works. It's pretty simple. If you can, call in. Call MBR prior to visiting, because that's just going to help you understand, what to do and how it's handled and what documents you need. It's really, really pretty simple. Now, if you're in an emergency and you can't call in before you go, then don't worry about it. Okay, they'll handle what they need to handle. Show them your card at the time of the visit, and everything else will be handled. You'll get a call from MBR helping you navigate your benefits. Okay, very straightforward and very simple. Nextly, I'd like to go to did I just say nextly? Additionally, I'd like to go to the APL, the insurance benefit portion of the plan, which I touched on earlier. Let's say, for example, person has a $1,000 MyShare IUA option, and they go to the ER, and then they are admitted to the hospital. So what's going to happen is you're going to get an indemnity, which is a reimbursement, a check in the mail for $50 because you went to the ER, and for $500 because you got admitted to the hospital. So yeah, you had your $1,000 IUA. However, you're getting $550 back. So you're only out of pocket $450, and everything after your IUA is shareable 100%. How amazing and how excellent is that? Okay. Doctor's office, you're going to get a $50 check. If you visit the physician's office 3 days in a 12-month period of time, a $50 reimbursement each time. Okay. That's how the indemnity plan piece works. I do want to touch on pre-membership medical conditions. This is page 13 of the brochure. Again, link nearby this video. There's a 1-year waiting period if you have a pre-membership medical condition. And then year 2, year 3, year 4, and beyond, there's a graduated scale of sharing medical needs for pre-existing conditions. Okay. Additionally, I'd like to now skip on to, these are all the member benefits through BWA. I will like to talk about the pricing now. And you'll see here, the pricing is outstanding in comparison to maybe a plan you've gotten through the health insurance marketplace. Maybe your employer, your previous employer was paying for part of your benefits, but now you've been let go, or you left that job, or you're on COBRA or something. You're going to be paying 2, 3, and 4 times as much as the rates you see here. So not only does this plan offer you excellent benefits, it's going to be saving you incredible amounts of money each month on your rates. Okay. So once again, my friend, he was paying $1,900 a month for his family of 4. And now he's paying for the best plan option, MyShare $1,000 IUA. He's paying only $870 a month. So he's putting almost $1,100 back in his bank account every single month. Once again, imagine what you could do with $1,000 extra back in your bank account. All right. So you'll see the pricing chart is absolutely incredible. And thank you so much for enjoying this overview of the plan. And I hope to see you soon.